Hello again. So this is part 2 of my cardiac pharmacology. I mistakenly forgot to add anticoagulants. It's like your Coumadin. I almost said Warfarin, but that's really the right way to say it. It doesn't matter either way. And statins, so your cholesterol meds. Real briefly before I get into those two, for the digoxin level, turns out I was right. It is 0.5 to 2. And I think there is a therapeutic range to look up. I don't remember, but I just know that over 2 is dangerous. So keep that in mind when you're studying for your pharmacology cardiac. So, all right, I'm going to get into the last 2 cardiac high yield. So your Coumadin, it has therapeutic range, and I believe is 1.5 to 2, if I'm not mistaken, or it's 1. All I know is that over 3 is a danger zone. So is why we have to test for the INR every so often. So that's with Coumadin. So keep in mind when you're looking at any test questions or practice questions, over 3 is bad. Below 1, we gotta kind of look and see, and then they may have to increase the dose depending on the protocol or what the doctor's comfortable with, but we have to report that. Okay, so then there is your and the rest of the anticoagulants, I'm sorry, which have bleeding precautions, so look out. So if a patient's telling you that they had this new bruise or they have bleeding in their gums, that's something to, as nurses, we need to keep note of and report, because the blood's thinning, and then we really want to prevent bleeding. So that's the idea. So definitely keep those in mind when you see those in a question. And then the next thing I want to briefly touch on will be your losartans, right? So the statins rather. So one would be losartans. So when you're dealing with those medications, they cannot be drinking grapefruit juice, and that's mostly taken at night, but they cannot drink grapefruit juice. And then also keep in mind that if they report increased aches to their muscles, or they report muscle weakness, be very aware of that, because that could mean they're going through rhabdomyolysis, which is a breakdown of muscle fibers. You can correct me if I'm wrong on that in my comments, but please keep that in mind, because that needs to be reported, and it could turn into a medical emergency. So I just wanted to cover that real quick, because I forgot to mention that's in the first part of my video. So this will be considered part 2. So I'm sure later in the week, either Thursday or Friday, I'm going to cover the insulin, because that is important to know. And I will cover Love is Blind, like I said, later on today or within the hour. We'll see how I'm feeling.